Getting you some health news now. The World Health Organization chief is said to visit Democratic Republic of the Congo amid Ebola outbreak. WHO Director General says the outbreak now includes more than 900 suspected cases and over 220 suspected deaths. Health authorities initially tested for the Zaire strain, but later discovered the cause is a much rarer Bundibugyo strain, allowing the virus to spread undetected for weeks. The general has urged neighboring countries to act immediately to contain the outbreak, and meanwhile, the World Food Programme's Ituri bureau chief warned that the outbreak and food insecurity are deeply linked.
There are health measures that suggest that people be contained in areas, but if these people are not receiving food assistance, they are not going to stay in the areas of containment. They are going to leave these areas and they are going to look for food. They will have to go in the markets, and by passing through the markets, they can infect other people. Most of the agencies that are on the front lines have had budget cuts. So the first thing to do is to ensure that long-term financing is sustainable and is ensured for all agencies. In the absence of resources, we will have to prioritize. We won't be able to reach everyone.
On a un déficit en termes de ressources pour cette année.
Now, several aid agencies have flown tons of relief into Bunia to help the hardest-hit towns of Bunia, Rambara, Mongwalu, but responders face deep community mistrust. Locals have burned down 2 of the 3 treatment centers established in those towns, and funding shortfalls are making the response harder. Experts say cuts to international aid last year weakened Eastern Congo's capacity to respond to outbreaks, and the resurgence of Ebola has also revived demand in Bukavu for locally made hand-washing stations. Artisans there say that orders from NGOs, businesses and residents have surged. Doctors welcome the renewed focus on hygiene, but they even caution that hand-washing alone will not stop Ebola in crowded cities. In Bunia, teams of health workers in full protective gears are conducting dignified and safe burials to reduce transmission at funerals.
To break this chain of transmission, we are implementing dignified and safe burials. And what do these dignified and safe burials consist of? They consist, when someone has died, of the teams arriving and starting with decontamination of the body. And they add all the other procedures to prevent infection, to prevent the population, the family from handling the body.
Now, fighting between government forces and the Rwanda-backed M23 militia has intensified in eastern Congo. The mineral-rich region has suffered decades of armed conflict, and experts say renewed violence since 2021 and intensified fighting since early 2025. It complicates the public health response now.